Hello students, we are now entering Unit 3 and this is Chapter 13 in the book. This unit is all about the postpartum period, so this is right after delivery of baby, placenta, and our recovery period. So there are a lot of big changes happening in mom's body. The baby is out, the placenta is out, we've lost blood, fluid, cord, might have sutures for an episiotomy, or if mom had a laceration, if she tore, or if she had to have a C-section, we're going to have a bandage over the abdomen. Remember REEDA, R-E-E-D-A. That is how you check any kind of incision in the body. Redness, edema, ecchymosis, drainage, we don't want that. Approximation, the A, we're looking for approximation on our wound. Postpartum consists of the period from delivery of placenta through 6 weeks post-delivery. There is a big push in the medical community to change it to 12 weeks post-delivery because they really want to try to catch those moms that are developing postpartum depression. So they think that by maybe having another scheduled doctor's visit that they might be able to catch some moms that are experiencing that. Involution is the process of the uterus shrinking back to its pre-pregnancy size. The fundus should be midline and at the level of the umbilicus. It should be firm. If it's not firm, we're going to massage the fundus. Oxytocin will cause the uterus to maintain its tone. The uterus will descend by about 1 centimeter, about 1 finger width every day. By day 10, we should not be able to palpate it. After pains are the uterus contracting back down. This can worsen with breastfeeding because breastfeeding releases oxytocin, our love hormone, which we know causes contractions in the uterus. Teach mom to take her pain meds accordingly. Those pains can get worse with each pregnancy. Ibuprofen works to reduce prostaglandins, which are causing the pain and inflammation. Exfoliation occurs at the point of placental attachment to the uterus, which means the tissue is sloughed off to become smooth again and prevent scar formation. As far as the lochia goes, it should go in that order. It should never go backwards, meaning once they hit the cirrhosis stage, they should never go back to that bright red blood. Something's wrong if they do, and they would need to call the doctor. They should refrain from having sexual intercourse until the lochia is gone, so possibly up to about 6 weeks. And they can get pregnant the very first time they have sex, so they need to think about birth control. The cervical os by day 14 should be back to about pre-pregnancy size. The vagina will return slowly to almost pre-pregnancy size. The woman may need some lubrication until her hormone levels return to normal. Her perineum just took a beating. She may have stitches, usually they're internal, you don't see them on the outside. She's going to be swollen, tender, and edematous. We're going to use ice for the first 24 hours, and then hopefully the hospital will offer a warm sitz bath. We're going to offer mom a water bottle. We are going to instruct her to squirt with the water bottle from front to back over her perineum area. She is going to pat the area dry with her tissue, and she's never going to wipe. We're just patting. Like I said, we're going to use ice for the first 24 hours. They may offer her Tux pads, hydrocortisone foam, whatever the doctor orders for her. We can encourage mom to start doing her Kegel exercises again. Breastfeeding is not contraception, you guys. If another child is not desired, birth control needs to be used. Remember colostrum The first stuff that comes out of the breast before true milk comes in, it is like liquid gold. All of mom's immunity is passed through. It's usually 2 to 3 days until milk comes in. Engorgement will occur. Even in a mom that is going to bottle feed, milk will come in, so we're going to help her with that engorgement. We can use cold packs, pain medicine, even putting cabbage leaves in the bra can help. It helps with engorgement. Do not pump in between feedings. This tells the body to make more milk, which leads to more engorgement. If mom has chosen not to breastfeed, we are going to advise that she has no nipple stimulation at all. She's going to put a tight bra on. She's going to leave it on, take her pain meds, no relieving any pressure. She'll just be telling her body make more milk. And usually the milk will go away in 5 to 7 days. She should even stand with her back to the shower. We don't even want the water hitting the nipples. On mom's skin, the dark spots should start to fade. The striae, the stretch marks, will fade. Hair loss can occur from all the hormonal changes, but it will resolve. Most moms are starving after they deliver. They're hungry. If they didn't have a C-section, they usually get to eat right away. Usually most doctors have moms that just had surgery start with ice chips and then they can progress. Hemorrhoids can occur during pregnancy or during pushing. Tux pads can help. Encourage mom not to push. Stool softeners are almost always given, so mom will probably have some Colace. They're very afraid of that first bowel movement. They're very afraid it's going to hurt. It is very important for the nurse to hear bowel sounds, especially after a C-section. We need to make sure that there's nothing going on in that gut. Blood loss from a vaginal delivery can be up to 500 milliliters and a C-section up to 1,000 milliliters. That's kind of expected. Blood flow is now diverted from the uterus back to mom's circulation. Blood lab levels are not truly accurate in the first 24 hours post-delivery from all the blood loss, fluid mobilization, and white blood cell increase, which happens after delivery. Clotting factors were increased during pregnancy, remember, so they're at risk of hemorrhoids, they're at risk of varicose veins, to make sure that we can clot off when our placenta detaches. So mom is at increased risk for a DVT. Early ambulation is so important. Usually moms that had a vaginal delivery, they just get up and walk themselves, but we really need to encourage moms that had a C-section. They should come out of surgery with the SCDs in place, the sequential devices. Moms can diurese up to 3,000 milliliters in a day. They're usually really hot, they're sweating. The bladder cannot be allowed to push the uterus up and to the side. It will not maintain its tone. We need to make sure that mom can urinate. If she can't, she might have to get straight cathed. We need to teach signs and symptoms of a UTI. Remember, dysuria, frequency, urgency, fever. We have to make sure mom understands to recognize those. This diastasis recti, there is also a picture in your book, figure 13.2, but this can be a real problem for women, especially women that are maybe of a shorter stature and their abdomen doesn't have as much room as a taller woman, for that baby, and it can really stretch their muscles. There are very specific exercises a woman can be assigned to do, and crunches are not one of them, so she needs to see a specific doctor for that. Here is a question, here is an answer. Postpartum psychological adaptations. Bonding is a very important part of the new parent's role, and nurses should observe this happening. If the parents remain detached, intervention may be needed. Some moms experience baby blues, which are usually self-limiting, and mom is still able to maintain care of herself and the baby. She might just cry for no reason, but usually it's just hormones and she's still functioning. Postpartum depression, on the other hand, lasts longer, and it's just like depression that you learned about in behavioral health. She may not want to take care of herself or the baby. She may not be getting dressed. Medical intervention is needed. If the nurse should observe the mother bonding with the child, ask questions, take the time to teach, especially new mothers. This can all be delayed if the infant has a deformity or is in the NICU. We need to help the parents feel comfortable taking care of their baby. Encourage them to touch and hold their child whenever they can, whatever care is appropriate for them to give if the baby's not with them or if the baby has a deformity. Sometimes, especially if they weren't expecting it, they might not want any pictures taken. So we always need to respect their wishes, but make sure that they feel that their baby is loved. You can't show any dismay or anything about how their child looks. Attachment is when the parents have established the emotional bond to their child. This may not even happen in the short time they're at the hospital, but nurses need to promote confidence in the parents' abilities. Fathers often have different ways of showing their attachment to the baby. Encourage hands-on care for dad and try to help mom understand that maybe dad's way isn't the way she does it, but if she criticizes everything he does, he's not going to want to do it. So we need to encourage dad. However he changes the diaper, he's got to clean it up, right? So just encourage any kind of care that he wants to give. What classes have the parents taken to encourage the sibling to participate in care to avoid sibling conflict? Maybe she's employing these tactics in the hospital.